Hello, Ron. Can you hear me? Excellent, excellent. Uh, it seems like you're. Oh, shoot. Hello, everybody. Thanks so much for joining us today. I seem to be having some issues here with my camera. Pardon me. Thank you so much again for joining us today. And as you know, Baltimore Innovation Week. I'm sure everybody has had their fill of looking into their screen today. But today we are going to be having a couple guests. First things first, we are actually going to be covering Coppin University's impact study research, specifically headed by Ron Williams, the professor in the College of Business in Coppin State University. And let me actually see what happened to him. Seems to have taken off. There he is. Perfect. Hello, Ron.
Hi, how are you? Technology, you have to love it.
Or hate it, right? Thank you so much, Dr. Ron Williams, for joining us today. And of course, as everybody know, if you guys have attended a lot of his sessions in the past, we are going to be talking about the organization assessment and economic impact study of makerspaces around the city, particularly with the height of COVID, where everybody really needed proper PPEs. I think many of these makerspaces really made it possible for a lot of our frontline workers to be effective, especially in the middle of this pandemic. So again, how are you doing, Dr.
I'm doing well. We're getting used to this new normal, I guess we would call it.
Absolutely. Absolutely. I mean, like you said, it's basically the new normal at this point. And actually, let me share my screen here, and hopefully they can they're able to kind of see that. But yeah, so a lot of the things that we've actually talked about, and what I can actually do is go ahead and I'm going to include the link into the document that we're going to be talking about called Greater Space and Places.com. And there you can find the research and impact study that we're going to be talking about. So, Dr. Williams, let's take it out to you and get things started here. And I kind of wanted to get things started with, some of the basic things that you started, and particularly the findings that you found during this impact study. So let's start off with that.
Okay. I'll give a little context. We were in relationship with OpenWorks since their beginning. Right after they opened in 2016, it was part of PNC Bank brought us together. The PNC had been funding some of the other work that we were doing. I learned about OpenWorks and connected with them, and then the work that we were doing got recognized by the Greater Baltimore Committee. We won the Bridging the Gap Strategic Partnership Award. And as a result of that, the relationship began to grow. And so I asked Will Holman in 2017, the executive director of OpenWorks, I said, what are the questions that we can help you answer? What do you struggle to answer when you're speaking to potential funders? And that's where the questions came from that became the basis for the study. So there were 8 research questions that we started out with. And we really looked at their first 3 years of operation and the economic impacts that they were having on Baltimore and the state. So it's a mixed methods kind of a study, the organizational assessment, but then the economic impact study. I think we're the first public HBCU to have a formal relationship with the Makerspace, a community embedded Makerspace, particularly of this size. Probably in the country, but it's been a fruitful relationship. So we conducted that study over the course of a year and released the study in 2019. And of course, the world has changed since then, but a lot of the findings are still very relevant. And so really, OpenWorks is probably the most diverse makerspace in the country. They are kind of an outlier because of their size, 34,000 square feet. They're embedded in the community. But what they have been able to accomplish over the 4 years now is absolutely phenomenal. So 4 things emerged out of the study in terms of the organizational assessment. What is it that's important to the people who are connected there, the members and even the community and their network? And one is the community itself, the community within OpenWorks. Is very diverse, very inclusive, and it's that way because they were very intentional from the very beginning, even from the staff, the board, the membership. When you come in, you really get a sense of community and belongingness. So that's one community, the space itself, the value of having a space where do-it-yourselfers and artists and small scale manufacturers can come together and work on projects and be innovative and be creative. So the space, having access to the space, and the cost, bringing the cost down so that, as they like to say, the democratization of tools, putting tools in everybody's hands. So those are really the 4 things that we found, and we've extended the work on organizational community into the area of trust because really we're developing a trust framework now that was born out of that work, just because of the sense of community and the institutional trust and networks that OpenWorks has been able to build. This year, we spun out of that, and because of COVID, we did a case study of their ability to produce 28,000 face shields in 56 days from a dead stop. And the reason that they were able to do that was primarily because of the strength of their community and the networks that they have been able to build, the interinstitutional networks they've been able to build in Baltimore and to pivot and be very agile. So not only did we learn a lot, now here's the I guess the big hit is that not only are they effective, but they put 9.9 million on the bottom line of the state of Maryland every year, and 8 million on the bottom line of Baltimore City every year.
Wow.
And that's reoccurring.
Yeah.
So the impact that they're having economically and the impact that they're having socially is absolutely incredible.
Excellent. Wow. And a lot of these things really bring up, it comes to relationship building, especially with your relationship with the Makerspace. Can you elaborate a little bit more on that end, on how you guys got together and actually prompted this particular research?
Yeah. As I said, primarily it was the relationship that we had with PNC. And, I did not know of the maker movement 4 years ago, 5 years ago. I knew nothing of it. I'm originally from West Virginia. I grew up in a maker community, so to speak.
Yeah.
We're not afraid to work with our hands, but I did not know it had become this thing, so to speak. So once I found that out, I was very intrigued by it. And when I observed the community that was building in OpenWorks and their network to the community, I was intrigued by the relational competencies and the relational intelligence that's required to do that type of thing. There's a quote by a researcher named Nurella Gur, Gur, and he says that trust is the foundational piece that affects the wealth of nations. So when you're building community internally and externally and building trust, which is the pillar of relationships, then it enables you interinstitutionally to be able to build wealth. And the even now, as we see what's happening, in the country, not only economically but socially, we realize that it's not that we don't have the tools, not that we don't have the knowledge. We can't get along. So if you're going to build wealth, if you're going to build a community of innovators, the first thing you must do is establish the relational competencies that are necessary for people to be productive and to work together. And that's what OpenWorks is. It's a microcosm of people, of a lab of people who learned how to do some things inclusively and collaboratively.
Yeah, excellent. And also, I just wanted to let everybody know, if you guys have any questions whatsoever, especially when it comes to the impact study that Dr. Williams created, please feel free to put that in the chat box, and we'll be able to cover that. Now, following on to the research, I think we discuss about some of the recommendations, or based on the findings. How do you think this will actually impact makerspaces in the future, not only in time but also future pandemics?
Oh, incredibly, because the fact that they were able to use their relational collateral, so to speak, to pivot once the crisis hit. When the crisis emerged, hyper volunteerism, the network came alive, the trust was evident. It enabled them to really pivot and implement and demonstrate lean manufacturing principles, agile manufacturing principles, real time, and to be able to respond in a crisis. We have a broken supply chain. So as we onshore manufacturing, bring it back to the United States, began to develop more inclusive manufacturing spaces, those are lessons learned from organizations like Makerspaces about plugging up some of the gaps in the supply chain, buying local, being able to pivot, being able to be lean in your approaches, listening to customers, being able to rely on the pull as opposed to trying to create a demand. Those kinds of things are what OpenWorks has been able to demonstrate. And I think that's the role that Makerspaces will play. Now, one thing that's critical is sustainability of the makerspaces, because most of them are small across the country. Again, there are not that many that are the size of OpenWorks and has the level of impact. So as we seek to connect these networks and the dots of makerspaces across the country so that they can have an impact on improving the supply chain responses and manufacturing in the future, we have to make sure that they're sustainable. And that's based on data, assessment, lessons learned, and continuous improvement.
Absolutely. I think, and that's definitely one of the most important things to think about, considering we're still in the middle of this pandemic. And of course, it doesn't hurt to plan ahead. Obviously, we're still waiting for the vaccine for this pandemic, so we'll see how that works.
Yeah. We have a lot of work to do.
Absolutely. And I actually saw a comment here from Lindsay, how this is actually a great example for public, private, and nonprofit partnership, which obviously it can be a logistical nightmare at times, considering there's so many moving parts around this. But as you can see, when you mentioned about volunteerism and people's passion to move this forward, I think that's kind of what attest to everybody's passion about that.
Yeah, well, to respond to Lindsay's comment, that's really what we wanted to demonstrate at Coppin. I mean, the relationship between the academic institution, a community embedded makerspace that has reach into the community, and a corporate partner. That was critical. And of course, everybody talks about ecosystems and being the innovation hub, but the reality is that we're all connected and unique, and we can create our own hubs. And as we connect those relationships, I think all of us will be able to advance together. But we have to make sure that, one, the trust is there, the relational intelligence and competence is there, that are going to allow those networks to emerge and allow us to work together.
Excellent. Well, I think that's one of the great thing about being in the USM umbrella is having all these student entrepreneurs, especially in the College of Business Education. I kind of wanted to know how this research would impact the way either the College of Business would teach, not specifically Coppin, but do you feel like this will affect how things are taught in entrepreneurship or in business classes, etc.?
Oh, no doubt, because the case study that we just finished, of course, I'm in the process of writing the instructional notes now, but this is the case study that we just finished is ideal for business school and entrepreneurship education, because it demonstrates the principles of lean manufacturing. It shows the collaboration and the importance of productivity. It's supply chain management. A case study, it's all of that. So it will change the way, well, I'll put it this way, it will inform the way that we teach. In the social impact model that I use most often, it's by a researcher named Mietenen, Miettenan, I think it is. There are three pieces, which is what are we learning? What are the artifacts that we are leaving? And what are the interinstitutional connections that we're using? And all of that helps to define what we call social impact. So we've learned a lot through this process. We're sharing that. We're leaving artifacts. We're publishing it. We're pushing it out both in non-academic and academic arenas. And we're building interinstitutional networks through conferences and opportunities like this to share. So that's how you have social impact. And when you're doing that, and when other institutions are doing that, and you're sharing, and all that's the innovation by definition.
Excellent. Well, I mean, that's definitely something to think about, especially for upcoming entrepreneurs. I know us here at Towson, we really want to push student entrepreneurship as much as we can, because it does create like a great pipeline of all these great entrepreneurs and ventures that could set up the future for the better, and hopefully can help with this Makerspaces. Any future projects that you guys are currently working on that's something similar to this or something different? Anything worth to mention?
Oh, yes. This is a continuous research stream for us. And because we have identified the community organizational community and the sense of community that's necessary, and trust as a pillar, we're developing a trust climate, trust profile assessment. So organizations will be able to assess the trust climate, not only within their organization, but externally, and then be able to, we'll be able to prescribe particular interventions that will help them in terms of their transparency and the cultural competency that's necessary. And if you think about how, institutional trust, for example, trust with the criminal justice system, if you want to develop that trust, you must be able to assess where you are in terms of transparency and also your cultural competencies that are necessary. So that's the research lane that we're in right now.
Perfect. Well, thank you so much, Dr. Williams. We really appreciate your time to share with us. Like I said, feel free to continue putting questions in. I'm sure Dr. Williams will be happy to answer that question in chat as we continue our panel for today. Like I said, I've included the link to his research, and we'd also like to connect with a lot of you folks. So if you guys want to add your LinkedIn profile in the chat box to connect, please feel free to do so. Thank you again, Dr. Williams. I really appreciate your time.
Thank you. Thank you for the opportunity.
Thank you. So up next, we're actually going to be bringing in 3 of the people I've closely worked with for the Startup Accelerator. One of them being Eric Hamrock. If you guys have been to the earlier session, he is the co-founder and CEO of Stochastic, one of the hottest startups in the local area. Of course, we are also going to have Nick Culberson from Protenus. I think he's here. Yep, there he is. Nick Culberson, a local startup that Protenus, which is a local startup that specializes in fulfilling a critical need to better patient data in electronic health records. And of course, Patrick McCowan, our executive director of entrepreneurship at Towson. During his time at James Madison University, he mentored several successful ventures such as BarTrack and Hungry. Hopefully you guys are on. Let's see here. And let's wait for, hey, Patrick, do you see a share audio or video button somewhere? Oh, let's see here. All right, there's Eric and Nick. Here we go. And Patrick is coming in hot.
All right.
All right. And here he is, man of the hour. And yeah, Patrick, take it away.
Okay. Thanks, Nick. And thanks, Dr. Williams. That was, or Ken, that was great. So my name's Patrick McCowan. I'm the executive director of entrepreneurship at Towson University. And today we have 2 exciting entrepreneurs with us, Eric Hamrock from Stochastic, who is a member of our inaugural cohort at the Accelerator, and Nick Culberson, who is the CEO and founder of Protenus. And so we have a really interesting talk to you today. Just by way of background, we're going to talk a little bit about their ventures and where they are and what they're doing, but also how COVID affected them. And what's really interesting is both these ventures are in healthcare, so they're on the same vertical, but they're at different stages. Eric is in the earlier stage and has not yet raised any money in any private equity. He is at almost $2 million in annual revenue, whereas Nick has raised $40 million and is at certainly the other end of the spectrum, but they're both on the same vertical. So this should be a pretty interesting talk because we have 2 companies, again, in the same vertical, but at different ends of the spectrum. So my first question to each of you is, as COVID came down and it's March, right? And we all kind of got the order, to go home and shelter in place. I want to ask, what operationally did you put into place? Not anything on your sales side or on your product side, but operationally, what did you guys do to get that in place and to keep functioning as a venture?
Yeah, I can go first, Patrick. So, I think it was interesting because I remember this very vividly. We were actually at a sales kind of meeting with a client locally, and we were talking about COVID, and we were looking at the Hopkins kind of famous graph and discussing that. And so at the time, it was very uncertain as to, you know, what was going to happen. I think some people thought, well, this could be just like a quick flu, it's going to be gone. Others were like, well, we don't know. And so, you know, talking to some of those frontline people on a in that clinical space, I think it was I didn't really, I was hearing different things. But I think as we sort of, when we really felt it and knew that it was real, is when we got a call. I spoke a little earlier today from a current client called OSF Healthcare that was, they're located in Peoria, Illinois. And so at that point, they said, look, this is real. We've got to adapt to this. We need something to help us to respond to this. And so they put in what's called a pandemic health worker program. And so operationally for us, we immediately, you know, started to scope out requirements, started to really just, you know, get everybody, all hands on deck, get together and really be, you know, responsive to that current client. So for us, it was kind of a drop everything and let's respond and you know, do what we can. And so we were able to stand that solution up really from beginning to end in about 2 weeks, and then had it into the client's hands. So it was something I've never experienced before. I'll put it that way.
Yeah, I can imagine so. And what about you, Nick? Because again, and when you answer it, if you can just tell us a little bit about your headquarters and any field offices you have and things of that nature, I'd be interested to hear that.
Yeah, we had a very similar experience to what Eric and his team saw. So our headquarters in Fells Point, we've hired over 100 people at this point, but we're over 30% remote. So we were really fortunate that we had invested really heavily into really good audiovisual communications, team collaboration tools. We had, you know, Slack, Zoom, like all sorts of like infrastructure built into our company so that when our employees needed to go work remotely, everyone could access, you know, their code securely. We could collaborate securely, and we could continue as we had in our headquarters here in Baltimore. So we didn't actually have a lot of hiccups that I think many companies experienced early in March, but we did experience exactly what Eric saw in the, you know, we sell to hospital systems too. And one of our core solutions is delivering privacy monitoring and security monitoring for hospital systems. Excuse me, my dog's gonna go crazy. So we saw when the pandemic rolled out, a lot of hospital systems were scurrying to track the patients that had been diagnosed with COVID-19. And that was really important for tracing, but it also created a lot of privacy and security concerns, because the more they exposed dashboards of patients who had been diagnosed internally, the more privacy was being breached. So our team jumped on that challenge really quickly, and we released a special analytic, a COVID-19 analytic that would help identify patients who had been diagnosed with COVID-19 and make sure there was extra protection on the record so that people weren't snooping or using that information inappropriately. So certainly a difficult time, but when you're on an agile, really passionate team, it's exciting to kind of go through that transition together, support each other, and ultimately support our customers as well.
Yeah, that's excellent. And I guess my next question is, Nick, do you have any plans to you know, take down some of your office space and reduce some of it, or are you going to keep it or increase it? What do you think your plans are going forward?
We're staying the course. So I've told my team we'll probably be one of the last companies to return to the office, because there's just no need for the risk. We can operate 100% or near 100% in this virtual environment, and so there's no need to return to the office. So that being said, we do have the intention of going back to our office. So we got a 5-year lease. We moved into Fells Point about a year ago, a little over a year ago. And we have every intention to return to the office and take advantage of that when this all clears. And, you know, our partners, you know, our landlords and our leasing partners have been really great to us, making sure that we Can you take advantage of the opportunity, just financially, but also make sure that we can have an opportunity to return there and leverage our space. And our team really loves the office. I really love our office. So I'm excited to go back. But that being said, I'm a big believer that if we are fortunate to keep our jobs and work remotely and stay inside, we want to make sure we can do whatever we can to not continue the spread and wait for the vaccine to come out or wait for it to get to a point where it's well contained.
Yeah, and I just want to say I commend both of you, and I can empathize with you. My first company, Proteus, very closely named to Pro Tennis. We had to go. We were in DC, and we had to go through 9/11 and the sniper, and that just absolutely pales in comparison to where you guys are. Lastly, on space, I just want everybody to know that Towson has a space coming online in late February, early spring. It's where the Armory is. If you're familiar with downtown Towson, it's now going to be called the Startup, TU being capitalized. Play on words there. It's about a 26,000 square foot space. Most of it is open to the public. We have Wi-Fi, LCDs you can plug into, plugs for electricity. It's a significant step up from Starbucks. There'll be a coffee vendor there. I might have already said the name. I'm not sure. And it's really going to be an exciting place. But then after that, on the second floor, we have offices that some of the ventures that come out of the accelerator can take. And Eric and his crew will be up there, and we're certainly excited to have them. So my next question to both of you, is since you're both in healthcare, and you touched upon it a little bit, but I'm hoping you can expound. What did you put into place on the strategic side with any of your products and services as COVID hit? Can you delve into that a little bit more?
Yeah, I think I'll take this one first, but I think what was unique about this is we had plans, and again, just to kind of recap, what we were able to do out in Peoria is that they had these pandemic health workers and potential COVID clients would call in, and they had a nurse that would kind of triage them. We provide basically an EHR that would allow data to come in. We have a triage prediction algorithm that we use that would kind of risk assess patients as to whether they could safely stay at home or would need to go to a more acute setting. And then we also had a component that was focused on the scheduling of those mobile resources. So these pandemic health workers that would go out and help with testing and supplies and things like that. But I think we had always wanted, we see the future of healthcare as taking it outside of the four walls of the hospital. We had chosen originally strategically to focus on the emergency department just because it's such a data-rich environment. And so, again, our core product had been a triage solution called eTriage that focuses on patients that come to the emergency department, and then we do the same thing where we provide a risk score for them. But I think what it did was accelerated our ability to kind of push our product roadmap out very quickly. And so probably Nick can speak to this some as well. Healthcare is a slower moving industry. And so, as you're trying to get clients to kind of move forward with innovative things, I think what we saw was, this acceleration of one, I think patients being more comfortable with the whole telehealth and remote aspects of healthcare, but more importantly, I think the providers saw that it fits in. So I don't think that there's, people may think, oh, well, there's not going to be hospitals anymore, that sort of thing. I don't believe that. I think we're always going to need, acute settings for the sickest patients. But I think what we've seen, I'm a father of three, there's these spaces where my wife, if she can have a telehealth visit for one of my kids with an earache and not have to pack everybody up and go to a clinic, that's very attractive to that segment of the market. And so, I think for us to kind of just recap, it really helped us to accelerate what we had already had planned in the mix and allowed us to realize that with the client. So that's really where we're focused now in terms of the next stage of our company.
Yeah, absolutely. And what about you, Nick? Were you able to strategically implement anything on your products and services?
So we didn't necessarily change anything on our products and services other than the COVID-19 analytic module that I'd mentioned earlier, just around making sure we could protect those patients' records specifically. That being said, it really helped amplify our message a bit. I mean, what we offer to hospital systems an opportunity to leverage AI and automation to make compliance more efficient. A lot of hospital systems use manual labor or manual audits, which is very time and resource intensive to maintain compliance. And when you have over 600 regulatory statutes you need to follow, it's just really difficult to do that manually. And so when the pandemic hit, a lot of hospital systems and hospital CFOs were immediately talking about concepts like systemness and efficiency and centralizing, and that really created a great opportunity, a great stage for our message of bringing healthcare compliance analytics to a single platform to leverage AI and make workflows a lot more efficient rather than disparate manual techniques. And so that really helped us, and many of our customers we've been able to partner with and demonstrate how they're actually increasing compliance while saving money and saving resources in this difficult time. So we didn't necessarily add on too much to our product strategy, but it certainly enhanced our messaging.
Yeah, and this is, these types of situations really kind of expose the good to great entrepreneurs. We heard, for example, with the cohort with the accelerator from Shai Pavelli, who's one of the founders of Hungry. And 2 weeks before COVID, they received a $100 million valuation and $25 million, from Jay-Z and Kevin Hart and, other luminaries. And they were doing catering, name brand chef catering to offices. So COVID hits and they go to zero. And now fast forward, and they are delivering, food contracts for the United States government, and also doing one-offs on cocktails and meals from name brand chefs. And they have more revenue than they had before. And so on that point, I wanted to take a shot in the dark and then go up from there. So Nick, in looking on your background, I went to LinkedIn. I know we're all connected to people sometimes we don't remember. Do you know Khalil Tawil?
We were both in the military, but we actually crossed paths through a program called the Pat Tillman Foundation. We were both Tillman scholars that supported me going to med school and Khalil going to law school.
So just FYI, I'm good friends with the author David Epstein of Range.
Mm-hmm.
He's on the board of the Tillman Foundation.
Oh, really?
Yeah.
I don't know him personally, but love the organization. It's a great group of people.
Yeah, it's a great organization. I'd highly recommend everybody read Range. It's a great book for entrepreneurs. And you're a vet as well, like Khalil?
Yeah, I served 8 years in the military.
Yeah, well, thank you for your service. I grew up a Navy kid. My dad's buried at Arlington. So again, something I can empathize with. So I would actually be curious, because again, I know Khalil well and mentored him with his venture Umi when he was at Yale, which is where I got my start in all of this. What was there anything, through your military service that kind of translated over to as you started Potenis and are growing Potenis and clearly being successful?
Yeah, I think that the obvious answer is, being able to react to changing environment, being able to, come together as a team. But I think the one thing that really surprised me is, we as a company are always trying to see around corners and prepare for worst case scenarios, which is typical exercise you go through in the military. In December, we went through this exercise called red teaming, which is where you create little teams in the company and ask those teams to say, what would you do to take our company down if you had to? Would you, start a competing company, or would you join a bigger company, or would you hack into our infrastructure? Like, come up with strategies on how to take our company down. And coincidentally, one of the teams came up with, we're going to release a global pandemic, and it's going to, devastate the economy, and it's going to devastate hospitals. And we were all kind of just like kicking ourselves, because I don't know if it was some kind of voodoo magic that then it actually came into place. But I can't stress how fortunate or how helpful it is to plan ahead and think about different contingencies. Whenever I talk to entrepreneurs and they talk about how much they want to raise money or how big they want a company to get, I always ask them questions like, when do you quit? What is the point where the company goes under? What does that look like? When do you run out of money? What is the kind of worst case scenario that you could hit as an entrepreneur? A lot of people don't put time and energy to think about that, but the more time and energy you put in to think about that, the faster you can react when that situation comes, because it's not a big wave that takes you off your feet.
Yeah. Kind of doing those KPIs and those metrics. What's the go, no go decision, right? And identifying those. Yeah, that's absolutely very useful. So my question to you, Eric, would be twofold. Given the current climate with COVID, what is the biggest obstacle that you're experiencing now that you weren't experiencing before? And then my second part of that question is, since you are in the middle of the inaugural accelerator, what would you say at this point, even though we're not done, is the most valuable thing you've gotten out of that?
Yeah, sure. I mean, I think to your first question, the product that we're focused on before the pandemic, I think we are getting traction in terms of new sales, but I think a lot of health systems right now, bandwidth is an issue. So trying to get people's attention and, especially in a sales environment where it's much, less touch based and, you're trying to get to people virtually. I mean, we've been participating in some conferences such as this virtually, and I'll say it's a lot different. You don't have those sort of organic, situations where you can really get to meet somebody and get to understand what their needs and problems are. So I think learning that, understanding that, and just trying to figure out new ways to get in front of people, that's something that I would say in terms of barriers that we've been focused on. I mean, we're in a stage where we've proven our technology, but we're really trying to get out there and to expand and to take it off, take it to the next level. So that's really what I'm typically focused on and trying to always improve on, is that kind of selling side of the business. I think we've done a lot on the building side, but we're really focused on selling. In terms of the accelerator, I mean, I think we're very fortunate to have the resources we have in this area. I mean, I spoke earlier, Deb Tillett and the ETC did a lot for us, but being part of the startup accelerator, it's been great. We have a very diverse cohort. So, myself, I would say, are one of the more, I'll say it, older guys in the group. So I'm kind of the gray hair, or, that sort. But we have, a lot of energy and a lot of just variety in what we're focused on. So, my biggest thing is, just working with you, Patrick, in terms of, somebody who's scaled technology and been able to exit it effectively twice. That's something that I'm always questioning my decisions and, thinking as a leader of a company, at times it can be difficult to kind of gauge the decisions you're making or have the information that you're having. So, we've gone a lot recently into things like selling and, how do we position our company, things like fundraising. And then, you bringing in, you mentioned Shy. We also had Ryan Croft, who was at Transit Screen. So some, DC-based entrepreneurs that actually went to my alma mater, JMU. So great to see that. And then, I've been able to connect with Nick just offline and, hopefully to continue that relationship. But, just being able to have access to people that have kind of gone before you and done things that you may be experiencing and seeing, what decisions did they make, what happened in those, and it just allows you to have a little more confidence moving forward as you're making those important decisions. Because in the end, I feel a lot of responsibility for my team to provide them with the leadership and the resources they need to execute on our mission.
Yeah, that's great. That's great. And just for everyone, I asked Eric when his birthday was, because I was going to try to nominate him for the Forbes Under 30. I was a little bit off though, but that's because he's an effective entrepreneur. But
2 years. I'm not that much old.
but looks good. And then as we wrap up, if anyone wants to put questions in the chat, I'll be sure to ask Eric and Nick. So Nick, my question to you is, I started at Towson just after Valentine's Day and had a lot of changes, doing a lot of things to implement, and then was kind of sent home. How have you, kind of adjusted, and do you see any decline, any increase, or is it the same as you work with your senior leadership team, and your investors, and continue to lead this venture, but knowing that, you're doing it over Zoom and everyone's remote and, all that type of stuff? I'd be curious to hear how that's going and what you've seen out of that.
It's certainly been a transition. I myself and most of my leadership team are in-person type of people. I know some companies have much more of a remote culture, but at least my team is very close, and we all enjoy going to the office and seeing each other. But I think there's a lot of silver linings in this pandemic, and I think one of them is the fact that everyone being forced into a remote environment has made more kind of openness and acceptance to it. I think people are more understanding about what it means to have kids in the backgrounds or have to split your day to teach and babysit and work. Spouses maybe losing their jobs or taking time off from work to take care of kids. All of this stuff, I think, makes people more sympathetic and understanding towards each other. And I think compassion, whether that's like in teamwork or in sales or in working with customers through support and success, I think compassion is so important in this time, and it's something that's really helped us come through. One of the other silver linings through this whole experience is I've actually talked to more startup or small company, large company CEOs since the pandemic started than I have in all 6 years in Pertennis. And I love talking to other entrepreneurs and learn about what they're doing, but everyone started talking to each other when the pandemic hit to hear, like, how are you doing this? Do you have to do layoffs? Are you able to, are your sales going up? And some companies flourish, like the one you mentioned, like some are able to really take advantage of the situation and really increase revenue. And others are devastated. Others are having to do layoffs and furloughs. Or I've even talked to a couple peer entrepreneurs that have had to close down their business just because of the impact. And, at the end of the day, what I always tell my team is count our blessings. Like, it's tough for everyone right now. You have to understand that it's a difficult time, regardless of what situation you're in, but we all have jobs, we all have work to do. Let's just be flexible and be compassionate toward each other and stick together to see this through.
So Nick, you and I met as your kind of chief of staff reached out to me to some of the stuff you're looking to do with Baltimore. And I was wondering if you could take a moment and talk about that and who's included in that and kind of what the objectives are and things of that nature. Yeah, of course. This concept is really early in ideation. So we haven't brought a lot of stuff together, but I think there's a really positive energy and excitement here. When I look at our company and the growth we've had, we've been able to recruit and retain a lot of great talent in Baltimore. Baltimore is known for its engineering, cybersecurity efforts. We have great academic academic centers that provide great cybersecurity and engineering programs. We've got DoD and three-letter agencies and government contractors. So really, there's moved out to the DC area just because there's a great talent pool here. I also think Baltimore is known for its diversity. Over 60% of residents in Baltimore are Black. But we don't see a lot of diversity in tech in Baltimore. And I think it's a bit of a shame that, we're known as this really diverse city, a real great melting pot and, really great leaders and ranked highly, I think number 3 and like great place for an engineer to get a job in the country right now. But we don't see these two things coming together. And so I reached out to a number of other CEOs at tech companies and said, what are you guys doing? How are you working to increase diversity in tech or increase diversity on our team? And we talked a lot about diversity and inclusion programs and the initiative that we're now calling Baltimore Tracks
is just an attempt to bring tech leaders together, start discussing how they're working through their diversity inclusion programs. How can we work together as a community and really just encourage more diversity and inclusion in the overall community? So I feel like I've learned a lot in the process, and I've really been amazed at what some really cool startups are doing and thinking outside the box to encourage more things like paid internship programs, or even as little as like how they recruit and how they reach out, like what partnership organizations they work with, whether it's Coppin State, Morgan State University. I mean, we have the 4th highest enrollment for HBCUs in the country, and a lot of great programs that are teaching really talented people about tech. So how do companies in the area tap into that and create more of a diverse environment? So again, very early in the ideation here, and excited to be working with other Baltimore tech companies to help solve this problem, or at least try.
Yeah. So, you know, I when your chief staff called me about that, I you know, had a long talk with him, and I, you know, grew up in a mixed race family where I have a sister that's adopted and half black, half white, and she's only 3 weeks younger than me. So I had to grow up saying, this is my sister, and everybody just, you know, looking at me cross-eyed. So that really shapes your worldview. You know, I was very excited to get behind it. So I applaud the work you're doing there. And it seems on our chat, we have Lindsay, Stephanie, and Sean that are all applauding too. So I venture to say we're all behind you.
Yeah, just real quick on that, Patrick, I appreciate that. And any tech leaders, any CEOs or head of diversity or head of people ops, tech companies in Baltimore want to get involved, definitely reach out. We'll put some contact information in the chat.
Excellent. Well, thanks so much. We will we'll keep it on time and end four minutes early, so everyone can stretch and maybe get to their next session and, you know, do the proper back exercises that we all need as we sit at a desk all day long like this. I know I do. And I just want to send out a, you know, very strong thank you and appreciation to Eric and Nick. These are 2 very busy entrepreneurs growing their ventures in a really, really challenging time. And they took the time to be with us here today as they, you know, love and support Baltimore. And so we're very fortunate to have them. And thanks again so much, guys.
Thanks, everybody.
Yep.
Thanks.
Good to see you, Nick. Take care.
Thank everybody. All right. So thank you again for everybody for joining us. Just a couple more things to talk about is obviously being partnered with USM. We wanted to mention a couple of things that they're providing as a COVID response as well. So right now, that's actually what you're seeing on my screen, which is the University of Maryland Task Force for COVID. University students, faculty are responding to COVID in crucial ways, and this task force actually brings them together with a focus on innovation, research, and research. It also connects the startups, small businesses, and large partners to help address the effects of this pandemic and better prepare for future pandemics. Another thing to mention, of course, is the COVID app challenge, which resulted in 6 teams of innovation receiving cash prizes and resources to further develop their apps, and could be supporting COVID patients or just detecting body temperature. And then on top of that, we also have the Maryland Business Rebooted, sort of, a free live webcam series that helps small and medium-sized business owners navigating the effects of COVID-19. Of course, with the help of University of Maryland Smith School of Business. On top of the all the other resources available provided by USM, we also have University of Baltimore's COVID Response Forum, which brings university scientific experts to answer questions. So if you guys have any resources that you need, I will include that in the chat box. And if you have any further questions, thanks again and have a great day.